I was reading an article recently about how there was a declining interest in BBLs, Brazilian butt lifts. And I shouted, hooray! I don't know how true that is. I don't know. But I mean, I've done a couple of videos on that subject on this channel, not as live stream, just standalone, just to reflect on the dangers, especially when we've had, I mean, in the UK, I think in the last 12 months, is it 12 months? I remember the story of this lady who, she went off and then had this procedure and then sadly, lost her life as a result of this. But there are people who would still go ahead, and even here, surgeons here have said that this procedure carries risks, even in reputable facilities with well-trained hands and so on. But people are still dabbling in certain things, and I think that's human nature, and it's about how safe can we make things for our for people
absolutely
in a particular healthcare setting, right?
I think with BBLs you're injecting huge volumes of filler into the buttock area, and not with appropriate aftercare being given, or clean techniques being used to inject, usually by people who aren't sufficiently trained and who've caused immense danger to life and even death. So it's a real shame.
And I think it's also passed off as non-surgical. I don't know how, I can't remember if there's a particular method where they say, oh, it's non-surgical, and so downplay the risk because after all, it's an injection.
Absolutely. and there was a Panorama, Panorama documentary a year and a half ago where just a person who is non-medical, a reporter, goes in with a hidden camera, goes into a clinic where they train people to do BBLs and fillers and Botox, and they don't even have any hands-on experience with a model, for example. They're just shown how to do it, and they walk out with a certificate saying they're okay to proceed to do these such treatments. So it's it is worrying, and I do hope that the UK government can bring in some sort of legislation to make things safer for our patients.